Patients struggling with infertility often ask me if pelvic physical therapy can help. Hi, I'm Dr. Jessica Babich. I'm a doctor of physical therapy specializing in pelvic health, orthopedics, and holistic head-to-toe recovery here in New York City. Pelvic floor PT is a well-established treatment for things like pelvic pain, urinary leakage, constipation, painful sex, and postpartum recovery. But when it comes to fertility, the conversation is more complex. And honestly, most people are getting confusing or oversimplified answers. So today, we're going to break it down clearly, what we do know and what we don't know. So when does pelvic PT make biological sense, and how it can support medical fertility treatments, not replace it? So what does the research actually say? Right now, pelvic floor PT is not considered a primary fertility treatment. There are a few small studies, mostly retrospective, looking at manual therapy for women with infertility caused by mechanical or structural issues like adhesions, pelvic congestion, blocked fallopian tubes, endometriosis, and PCOS. One retrospective study shows pregnancy rates between 39 and 58% after a series of manual pelvic treatment. But here's the science part. These studies were small. They did not have a randomized controlled group. And the improvements could have come from time, lifestyle changes, or other medical care. So while the results are promising, they're not strong enough to call pelvic PT a proven fertility treatment yet. So why is manual therapy hard to study? Unlike medicine, where every pill is identical, manual therapy is individualized. It depends on the therapist's training, their hands, the patient's anatomy, the tissue quality, pain sensitivity, and their nervous system state. Two therapists don't treat exactly the same way, and two bodies don't respond exactly the same way. So large clinical trials are harder to run and harder to reproduce. That's why the research is early, not because the biology doesn't exist. And that brings us to the important part. How do we see these biological changes play out in real patients every day? Pelvic PT is not making someone fertile. What we are doing is removing mechanical and functional barriers that can interfere with pelvic health. Pelvic PT may help when infertility is linked to things like scar tissue or adhesions from surgery, infection, or endometriosis, or restricted mobility of the uterus, the ovaries, or the fallopian tubes. Pelvic congestion, which is reducing blood flow, postural and pressure system dysfunction, limiting organ movement, constipation or gut dysmotility, crowding the reproductive organs, pain with intercourse, preventing conception altogether, pelvic floor tension or vaginismus, making penetration painful or impossible. In these cases, pelvic PT isn't replacing fertility care. It's removing obstacles that the body has been working around. Your reproductive organs sit inside a pressure system that includes the diaphragm, the abdominal wall, and the pelvic floor. Picture it like a canister. The diaphragm on the top, the pelvic floor on the bottom, and the abdominal wall around. When this system isn't balanced from either chronic bracing, shallow breathing, scar tissue, surgery, inflammation, or constipation, pelvic organs often lose space, their mobility, and circulation. So improving our breath mechanics, abdominal mobility, pelvic floor coordination, and gut movement can reduce congestion and improve blood flow to the reproductive organs. This isn't magic, it's physiology. It's also one of the reasons acupuncture helps women. Better circulation, calmer nervous system, decreased inflammation, improved pelvic blood flow. Different tools, but similar mechanisms. As a part of pelvic PT, some therapists, including myself, are trained in visceral manipulation. This is a gentle, hands-on technique developed by French osteopath and researcher Jean-Pierre Perrault. Visceral manipulation focuses on improving mobility and motility of organs and the surrounding fascia. So mobility is how well an organ can glide and move against the neighboring structures. The bladder sliding against the uterus, the ovaries moving with the breath, and the intestines gliding with the abdominal wall. Motility is the organ's inherent rhythmic motion. It's subtle movement that supports healthy function and communication within the body. When mobility or motility are restricted by scar tissue, inflammation, abdominal pressure, or fascial tension, organs can become compressed or sluggish. This can affect circulation, nerve signaling, and lymphatic flow. When we restore mobility and motility, blood flow, lymphatic drainage, and the nerve signaling improves, helping tissues regulate inflammation and function better. We are not claiming visceral manipulation treats hormones, but hormones don't work in isolation. They work within tissues. If an organ has better circulation, less compression, and healthier movement, the environment those hormones act on can improve. That matters for issues like pelvic congestion, inflammation, and fluid stagnation, all of which can affect the pelvis and reproductive system. This is one of the many reasons fertility clinics now collaborate with acupuncture, pelvic PT, and massage. It's for the improved blood flow, the calmer nervous system, and better tissue health and mobility, not as a replacement for medical fertility care, but as a supportive therapy that helps the body function the way it was designed to. So where does pelvic PT fit into real-world fertility care? Pelvic PT should never replace medical care for fertility, but it can be an incredibly valuable adjunct when there are painful pelvic exams, painful sex, guarding or muscle tension, pelvic pain from endometriosis, scar tissue after a C-section, or pelvic or abdominal surgery, PCOS with pelvic congestion or constipation, chronic bloating, pushing into the pelvis, vaginismus interfering with intercourse, or IUI procedures. We work together with reproductive endocrinologists, not instead of them. And for many women, pelvic PT helps the body function the way it was designed to. So, does pelvic PT help with infertility? And here's the honest answer. There is early evidence, especially for the mechanical causes like adhesions and pelvic congestion. Biology supports the possibility. Anecdotal and clinical success is common, but big randomized trials are still needed. So for now, pelvic PT is best viewed as a supportive therapy, not a cure, not a guarantee, and not a substitute for medical fertility treatment. If you are working with a reproductive endocrinologist and want to optimize blood flow, pelvic mobility, intercourse comfort, and nervous system regulation, pelvic PT can be an incredibly helpful part of the puzzle. If you're navigating infertility and wondering whether pelvic PT could help, talk with your provider or reach out to a pelvic floor physical therapist trained in manual therapy, visceral manipulation, and pelvic pain. You don't have to do this alone. If this video helped you feel more informed, confident, or more hopeful, hit like and subscribe and share this with someone who is on the journey too. And if you live in New York State and would like personalized guidance, you can work with me, either in person or virtually. I'm Dr. Jessica, and I'll see you in the next video.